very good evening to you. You're watching News 9 Digital. I'm Pratibha. While our focus has been on fighting coronavirus, and rightly so, it's also important to note that there are other infections which are extremely deadly that have now taken a backseat. In fact, India has one of the world's highest number of bacterial infections. There are several infections that several people are suffering from: tuberculosis, cholera, typhoid, pneumonia, and many more. So when coronavirus pandemic had begun, in fact, many had also unfairly compared it to tuberculosis. But our country does have much to worry about, and especially when we have the highest number of tuberculosis patients in the world. Well, TB is an airborne disease which is highly concerning. It's something that we should all be concerned about. TB is not the only disease, of course, plagued by superbugs, pneumonia, and there are other common bacterial infections as well that also feature in the list, and we should be highly wary of them. Superbugs are, of course, strains of bacteria, viruses, and parasites as well as fungi that are resistant to most of the antibiotics and any other medication that is commonly used to treat the infections that they cause. In fact, drug-resistant infections annually kill over 7 lakh people across the world. This is a figure that could reach even 10 million by 2050. This is extremely worrying, and there is an immediate need as well to know much more about the serious threat that they pose of antibiotic resistance. And this is especially important in India because in India their use is quite high because of misinformation. The consumption is quite high. There is easy availability as well, which is extremely concerning. To discuss more on this, joining us live is Dr. Sajal Ajmani, rheumatologist, clinical immunologist, practicing in Delhi. He joins us live now. Thank you so much for joining us, Dr. Sajal. It's quite unfair, of course, to compare any disease, but the numbers are quite startling. What would you say about it? Would you say that in this fight against coronavirus, other diseases were ignored?
Yes, I mean, the focus right now, although correctly, is on coronavirus, but other diseases are being neglected. Patients are ignoring their symptoms or are reluctant to visit their doctor, clinics or hospitals in the fear of contracting corona from there, leading to delayed diagnosis when the treatment becomes more difficult. Diseases such as tuberculosis and other infections like pneumococcal influenza are taking a backseat. And although the focus should be on corona, but one should not forget to test for these symptoms, for these diseases as well, and to consult a doctor. If one is reluctant to go to the clinic, then maybe teleconsultation modes of many hospitals are offering, both government and private, and one should not ignore these symptoms or get tested only for coronavirus on their own. They should visit a doctor and get whatever test the doctor prescribes for their symptoms.
Okay, so it's better to be careful about it. But also, doctor, can you explain superbugs, and if you can tell us how concerned we should be about it?
So superbugs are basically pathogens, organisms which are resistant to the commonly available antibiotics. They are basically coming because of overuse and misuse of antibiotics. India, in fact, has the highest rate of consumption of antibiotic per person. So even if you adjust for our population, we have the highest antibiotic use. The reason for that, like you said, is people can a lot of times take it from the chemist themselves without needing a prescription. They self-medicate without consulting a doctor. Doctors also use higher-end antibiotics, the latest antibiotics, when the older can be easily used. Plus, so one is self-medication, one fault lies at the clinician themselves. The third would be that a lot of times a patient has viral fever or viral infection, and one takes antibiotics. Antibiotics don't work against viruses; they work against bacterial infection. So a lot of times we have fever or running nose due to a virus, and we are taking antibiotics, which are not required. And the fourth reason for antibiotic resistance coming in organisms is because we do not complete the course of antibiotics. If the doctor has prescribed for 10 days, some people a lot of times take it for 5-6 days
True.
and they feel better and stop taking it.
Okay.
So it should be correctly used and the full course should be taken.
Okay.
And these are a big concern. And if superbugs increase, then we have nothing to treat them with.
Okay, so taking antibiotics incorrectly or when it's not required, could it be dangerous? And would you say that there is enough knowledge about antibiotic resistance? Do not many people know about it? And is it really very easily available? As we know, it's widely available in India as well. And is it something that should be curtailed?
Yes, it should be regulated.
Okay.
Many hospitals now are following antibiotic policy, in which if you have to use the latest antibiotic, you have to justify the reason for it.
Okay.
So you cannot prescribe it without justifying it, that this or proving that the drug is resistant to the other easily available, cheaper and older antibiotics. So self-regulation and regulation by hospitals and the physicians themselves should be is slowly coming up. All the big centers, tertiary care centers, even all the government hospitals usually have a antibiotic policy now.
Okay.
And like I said, patients should not themselves take antibiotics without consulting doctors. They can have side effects. Any drug can have potential side effects. So without a proper prescription or a consultation, one should not take it.
Okay. All right. Dr. Ajmani, many thanks for joining us live. Well, concerns have been raised on the prescription-based antibiotic drugs that are being sold in the market like over-the-counter products. And doctors advise the use of antibiotics only if it is prescribed by a doctor. So beware and ensure that you're extremely careful when you take any antibiotics because it could prove to be dangerous. Well, that's all I have for you today. Thank you so much for joining me live. Please like, share and subscribe to News9 Digital. I'll see you in the next video. Take care.